Today I want to talk to you about the various laser procedures we have available to correct your vision to reduce your dependence on glasses and contact lenses. It's basically an alphabet soup, and you've probably seen these terms before. PRK is photorefractive keratectomy, LASIK is laser in situ keratomileusis, and the new one is called SMILE, small incision lenticule extraction. We're going to kind of go through each one of these in detail. The PRK procedure involves removing the surface layer of cells, which are like skin cells, from the cornea. That's followed by the laser to do the reshaping, which is customized to your correction, and then a contact lens is placed on the eye. The total procedure takes about 15 minutes to do both eyes. The contact lens will stay on for 4 days. That's how long it takes the surface cells to heal. During that time, it's intermittently light sensitive, tearing, sandy gritty feeling in the eye, and the vision is going to fluctuate. The vision improves fairly rapidly once we take the contact lens out. The contact lens will be taken out on the 4th day after surgery, but it's about a week before patients feel comfortable driving in general. The light sensitivity, the scratchiness lasts while the contact lens is in. Usually the second post-operative day is the most uncomfortable. The vision can actually take a drop on that second post-operative day. PRK in general does have some risk of dry eye that most patients will experience for 3 to 6 months. In unusual situations, it can last up to 1 year. PRK has been around for more than 25 years. PRK is typically used in patients who have corneas that are on the thinner side, which does not allow us to perform LASIK because we don't have enough tissue to work with to perform the flap and the correction for the vision. It's appropriate for patients with nearsightedness and astigmatism and farsightedness and astigmatism. LASIK was created to shorten the recovery time that was experienced from PRK. LASIK involves using a laser to create a flap. The flap is reflected back, and the other laser is then used to do the reshaping the same way it's used in PRK. But now when we reposition the flap, the surface is essentially intact, and so it's a very fast recovery time. The eye is light sensitive for about 4 or 5 hours while the edge of that flap heals. Typically suggests patients go home and sleep through that time. Vision is excellent on post-operative day 1, and patients can drive themselves in for the post-operative appointment. The vision stabilizes very quickly. Within several days, the vision is really at the point it will end up as the final vision. The light sensitivity, as I mentioned, lasts for a very brief period of time. This is why LASIK has become so popular over the PRK procedure. It does have associated with it the same dry eye risks that PRK has, and on average patients have dryness for 3 to 6 months following the LASIK procedure. PRK and LASIK are both appropriate for patients that are nearsighted and with astigmatism, which is a football shape to the front of the eye. LASIK is the most commonly used procedure for nearsightedness and astigmatism and farsightedness and astigmatism. We are limited to some level with higher corrections with LASIK because we need room for the flap. We have to have enough corneal tissue to create the flap and perform the laser correction for the vision. The newer procedure is called SMILE and involves using a single laser to create a contact lens shaped piece of material within the cornea. The small tunnel incision is also created with the laser, and then that contact lens shaped piece of material is removed through that small tunnel incision. The procedure is quite rapid, lasting about 10 minutes. The discomfort, the scratchiness of the eye lasts for only a few hours. The eye can be light sensitive for a few days. The vision is excellent on postoperative day 1, usually about 90% of the full correction. The remaining 10% can take several days to settle in. The great thing about SMILE is it is minimally invasive, allows us to treat higher corrections of nearsightedness, and typically results in a shorter duration of dry eye than we would see with a LASIK or PRK procedure. Thanks for learning more about these amazing procedures that we have available at the Hamilton Eye Institute. I encourage you to visit the website, RexHamiltonMD.com, and contact us to set up a consultation so we can get you started on the road to freedom from glasses and contact lenses. Hi, this is Dr. Rex Hamilton of the Hamilton Eye Institute, and today I'd like to talk to you about the process of going through laser vision correction surgery, something that can be incredibly liberating to you and your lifestyle. There are essentially 4 steps. First is the initial consultation. Then we do a pre-op visit Then we have the actual surgical procedure itself, and then there's the post-op and recovery. The consultation begins, or can begin, online, where we can do a Zoom call, where we can talk about your specific goals for vision correction. What are your hobbies? What's your occupation? What types of things do you like to do? And then I can show you online, because I can share a screen, exactly what we might do with your eye to correct your vision. We then, of course, want to see you in the office because it's important to measure specific parameters of your individual eye. Everybody's eye is different. And specifically, when we're talking about things like LASIK, PRK, or SMILE, we're looking in very detailed way at the front surface of the eye, which is the cornea. Everybody's eye has a different shape, different size, different curvature, and we have sophisticated ways of mapping that out. Once we've done that, and I've looked at your eye under the microscope, I'm going to tell you what I think is the best procedure for your specific situation. Once we've done that, we'll schedule a pre-op visit, which is where we're going to dilate your pupil, we're going to look in the back of the eye, make sure the retina, which is the film in the camera in the back, looks healthy, and that there's nothing going on that might need attention. And then we'll decide exactly when we want to do the procedure, and we'll schedule that procedure for you. Then comes the day of the surgery, and everybody's always a little bit apprehensive. Well, that's no problem, because all of these procedures are quick. They take between 10 and 15 minutes. We give you a little bit of Xanax when you come in to take the edge off. And that brings us to the LASIK procedure, which is 2 steps. The first is creating a flap using a laser. We fold the flap back. We use a laser to reshape by removing small amounts of tissue to change the curvature. Then we're going to replace the flap. The flap allows for very fast healing because it's just the edge that has to heal now. So the next day, the eye feels pretty much normal, the vision is excellent, you're back to most of your normal activities in one day. There are still some limitations with LASIK in terms of that first week. No eye makeup, we don't want you playing contact sports, no swimming for that first week. In addition, the eye tends to be a bit dry for several months. There are some eye drops that you're using for a range of days, somewhere from 7 to 10 days. Post-operatively, we will see you back the next day after the procedure. We'll check your vision, check eye pressure, and make sure everything looks fine. And then we follow you up somewhere around a month to 3 months, depending on the procedure. We're excited to see you here at Hamilton Eye Institute to get you started on your journey to get the best possible vision that your individual eye can achieve. If you'd like to come see us, we'd love to hear from you at 424-732-2020. The other option is to visit us on the web at RexHamiltonMD.com.
Hello, I'm Rana Jaraha with EyeWire TV. Thank you for joining us. In our top story, the FDA has expanded its approval of the Zeiss Relax Smile procedure to include the treatment of myopia with astigmatism. The Zeiss Relax Smile procedure utilizes the VisuMax femtosecond laser to create a lenticule inside the cornea and an incision in a single treatment step. The VisuMax uses 1 laser instead of 2 through ultra-short microscopic bursts that cut through tissue. With the approved new indication range, the surgeon now has the option to benefit from extended technical parameters. The pre-market approval also provides for a small entry incision to be made, allowing the SMILE procedure to be potentially less disruptive to the corneal surface tissue. The VisuMax femtosecond laser was first approved by the FDA to perform SMILE in September 2016. It has since received 510(k) clearances for use in LASIK flap surgery, keratoplasty, and the insertion of corneal implants to correct vision. To learn more about the advantages SMILE may provide, EyeWire TV recently spoke with Dr. Rex Hamilton.
As a LASIK and PRK surgeon, we're very much interested in alignment of astigmatism, centering the treatment. And we're used to having pupil trackers, iris registration. SMILE is different in the sense that we have control of the eye during the entire creation of the lenticule. So the eye actually cannot move. So we do not need to have a pupil tracker because the eye is not free to move. Now it is very important to center the SMILE treatment. That's critical, and there are certain techniques you can use to ensure centration, but a pupil tracker and iris registration is not necessary. Predictability is hugely important to the refractive surgeon. And those of us who've done PRK and LASIK understand that a nomogram, which is based on previous results, is hugely important for PRK and LASIK. For SMILE, it actually is, in my opinion, a bit more predictable. There is a very tiny nomogram adjustment, if any, based on your individual laser. So it is an extremely predictable procedure that I would argue is more predictable in many situations than LASIK.
Zeiss says that over the last 10 years, more than 1.5 million SMILE treatments have been performed worldwide, constituting over 10% of global laser vision correction procedures.
I'm getting SMILE, so I don't have to wear these babies ever again.
We're going to do the SMILE procedure, which is a newer procedure that we have. It's similar to LASIK, where we're trying to get rid of these. Now she's of the age that she probably doesn't read clocks with hands, but we'll see if she can tell. There we go. Almost 9.
Awesome. This is so weird, I can see you guys. Like it's a little cloudy, but I can literally read what that says.
Right, it's like looking through a fog right now.
I like want to try it. I can literally read that.
Yeah. So
I wouldn't even know that had words on it.
Right. So
it's like a little pressure, but like obviously you're right there.
Yeah.
And like you're just like, good. Yeah, looking at the light. And then you're like, boop, it's over.
It's far and away the cleanest, quickest procedure that we have.